Good afternoon, everyone, and welcome to the webinar, Asking This Critical Question Can Make a Difference. Have you or a loved one ever served in the military? Sponsored by SAMHSA service members, veterans, and their families' Technical Assistance Center. My name is Samantha Holcomb. I'm a Director of Practice Improvement for the National Council for Behavioral Health, and I will be serving as your moderator this afternoon. Before I begin, I'd like to draw your attention to some important webinar logistics. During today's presentation, your slides will be automatically synchronized with the audio, so you will not need to flip any slides to follow along. You will listen to audio through your computer speakers, so please ensure they are on and the volume is turned up. You may send us questions at any time during the webinar by typing your question into the Ask a Question box in the lower left portion of your player. Depending on the question, we may type an answer back to you or save it for the end. We'll answer as many of your questions as time allows at the end of this presentation. This webinar is being recorded, and an audio version of the entire webinar, as well as a PDF of the presentation slides, will be available on the Webinar Archives page of the National Council website within 48 hours of the broadcast, as well as sent out to you post-webinar. Following the webinar, we invite you to please complete a brief survey. Finally, if you need technical assistance, please click on the question mark button on the upper right corner of your player to see a list of frequently asked questions and contact info for tech support if needed. I'll now pass things off to Michelle Cleary.
Samantha, thank you very much. Welcome, everyone. This is Michelle Cleary from SAMHSA Service Members, Veterans, and Their Families Technical Assistance Center. I'm standing in today for our project director, Donna Alvarado, who is experiencing some technical difficulties. Next slide. So for those of you who are familiar with our Technical Assistance Center, we are a collaboration across several federal agencies, the U.S. Department of Veterans Affairs, the U.S. Department of Health and Human Services, and the U.S. Department of Defense. Next slide. Our TA Center looks to foster collaboration among military and civilian stakeholders. We also try to provide a centralized mechanisms for our cities, states, and territories to help learn, connect, and share. And we hope that this webinar will be a wonderful opportunity for you to do that. We are also looking to increase awareness of and access to resources and programs that strengthen the behavioral health care systems for our service members, veterans, and their families. And we're also supporting coordinated responses to the behavioral health needs of service members, veterans, and their families. And finally, we're encouraging cities, states, and territories to implement promising, best, and evidence-based practices. Next slide. This slide is a snapshot of the work that we've done throughout the country in this last year from 2017 to 2018, and several innovative initiatives that look to help our states and cities and territories better coordinate systems for our service members, veterans, and their families. Next slide. So for today, our webinar objectives are really to provide an overview of how to ask about prior military service when you're screening someone or when you're interacting with someone who may be a service member, veteran, or a family member. Also, we will be reviewing recent studies that outline how quality care is tied to screening for military service. We're going to take some time to describe successfully implemented initiatives. We're going to hear from both Dr. Susan Shi and Joe Moncher from New Hampshire, and they're going to talk about the initiatives that they've implemented with their organizations. And we're also looking to strengthen support structures within behavioral health agencies by recognizing who's being served and how we can support those people who we're serving. Next slide. A few more objectives. We want to help focus on some best practice approaches to transforming a behavioral health care service system from within. We also want to describe for you how to engage stakeholders and leadership. We want to discuss ways to create internal military liaisons and/or military and veteran family support teams. And finally, we want to explore how to connect the Ask the Question campaign across all service member, veteran, and their family program areas. Next slide. So now what we want to do is just stop and pause. We recognize that Veterans Affairs, the utilization of VA, as most of us refer to it, many veterans receive care outside of the VA, and that's a really critical component to why we're having this conversation today. 48% of all veterans use at least one VA benefit or service in fiscal year 2016, and nearly all elderly, age 65 or older, have Medicare coverage. A majority of younger veterans, more than 75%, have coverage options that are outside of VHA care. So we know that service members, veterans, and their families are intersecting with care in our communities. And when we have an opportunity to recognize them in our service system and in our communities, we can connect them to services and care that are available outside of the VA system. Next slide. So the reason that we wanted to host this important webinar as we kicked off the month of November and honor Veterans Day and honor the month of the military family, we wanted to make sure that this message and these examples of initiatives were highlighted because we recognize them as really connecting service members, veterans, and their families to tailored resources. We also we are also hoping that this webinar will advance an understanding of behavioral health needs for service members, veterans, and their families at a community level, and then also really giving thought to how we're planning, funding, tracking, and measuring impact when we recognize our service members, veterans, and their families who we're working with. Next slide. So, a couple of the things that we want to be thinking about prior to turning this over to Dr. Shi and Ms. Monsher is which question? How and what do we ask? So often we encounter a conversation when we're talking about how to identify veterans in our community, and people will say, well, we do ask the question. We ask if someone's a veteran. What we know from our work throughout the country and what the American Academy of Nursing knows and what New Hampshire knows and what many of our other states and cities are coming to recognize is that that question is not a question that is answered often in the way we expect it to be. So what we've realized is that the question needs to be asked differently. And Dr. Shi will talk about the initiative from the American Academy of Nursing. Ms. Monsher is going to talk about the initiative from New Hampshire. What we suggest is asking a question of have you or a member of your family ever served in the military? And that will allow for a better understanding and a better recognition of who we were working with, because often people will not either say that they're a veteran, and there's a variety of reasons for that, or they may not even stop and think about it, especially if it's a family member. So it can really be an important question that begins the conversation and allows for a better understanding of who you're working with. The other piece that I mentioned, have you or a member of your family ever served in the military? Who, when we're talking about the family component, is a question that you can determine. Different entities will decide whether a family member is a close family member, but close is also defined relatively. But for example, my father served in the military. I would not necessarily have thought of him and categorized his veteran service, but if someone had asked me that, I would have been able to acknowledge that as a caregiver of his. So there's a lot of opportunities for us to connect to people who may have veterans or service members in their family, and we can then help them better connect to services. So there's a lot of different ways to be thinking about that and defining that. And then finally, when to ask. And both of our presenters are going to talk a little bit about opportunities of when to ask the question. Next slide. There are other examples of Ask the Question campaigns, and we did want to pause to acknowledge them. So the HIV/AIDS campaign has an Ask the Question campaign. There's also a suicide prevention Ask the Question campaign. And now today here we're talking a little bit more about what we label the Ask the Question campaign relating to military service. Okay, next slide, please. Okay, so having taken a few moments to just talk to you a little bit about the webinar. I now want to introduce our first presenter, who is Dr. Susan Shi, and she is a professor at the University of Delaware College of Health Sciences, School of Nursing. She also has served in the military. She served on active duty in the U.S. Army Nurse Corps and the U.S. Air Force Reserves as a flight nurse. She is known nationally and internationally for her work in emergency, trauma, and catastrophic injury care. Dr. Shi is the author of 12 editions of textbooks, more than 80 journal articles, and numerous book chapters on emergency trauma care and spinal cord injuries. She has served on a number of boards and committees, including the American Academy of Nursing Expert Panel on Military and Veteran Issues. And so we welcome her today to be able to present about the initiatives that the American Academy of Nursing has done. So Dr. Shi, I'll turn it over to you.
Great, thank you. Next slide. So hi, as Michelle said, my name is Susan Shi. I am a Vietnam-era veteran. I served active duty in the Army Nurse Corps and then did 4 years of flight nursing in the Air Force Reserves. I'm on the faculty of the University of Delaware, but also am adjunct faculty at Uniformed Services University in Bethesda, where I taught for the last 6 years in the Graduate School of Nursing and the Medical School, where all my students were active duty military members. I'm also representing today the American Academy of Nursing and the National Advisory Council for the Have You Ever Served initiative. Next slide, please. So with the newly minted Veterans Care Act, more and more veterans are going to be seeking care in civilian healthcare facilities. We actually put this program together, this initiative at the American Academy of Nursing, specifically for healthcare, but I think people are welcome to borrow any parts of this to help you with whatever you're doing with veterans in your line of work as well. So approximately 42% of total veteran population are enrolled in the VA healthcare system. That's about 21.5 million veterans. But approximately 65% of them enrolled use the healthcare system, and that means that another 35% are not using the VA healthcare system. That's about 7.5 million veterans who either seek health care elsewhere or don't seek health care at all. And sadly, our veterans numbers are going down. It's declined by 17% since 2001 because of the passing of our very cherished World War II and Korean War vets and many Vietnam veterans as well. So the Have You Ever Served initiative is an awareness initiative that was created by the American Academy of Nursing a few years back, and we've been implementing it. And it's meant to improve the health care of all veterans and their family members across the nation. There are many surviving veterans that survived the current wars, not most current wars, but go back to World War II. We have lots of World War II vets surviving, Korean War vets, Vietnam vets, Desert Storm, Desert Shield, OIF, OEF, OND, and everything else in between. So in order to be able to serve them well, we need to know where they served, when they served, and what they did when they served, so that we can help identify diagnosis appropriately, etiologies of those diagnoses, and appropriate treatments, and if they're eligible for VA assistance and healthcare financial help. Next slide, please. So if we're trying to have every healthcare provider always ask the question of any patient, have you ever served in the military, or has anyone in your family ever served? So if they come into the emergency department or a clinic or the doctor's office, we want to ask this question. And it's important that we find out what their military history is. So asking the questions, which branch did you serve in? When did you serve? Where did you serve? What did you do while you were in the military? What was your job? Were you deployed to a hostile area, a combat area? And did you experience enemy fire or see combat or witness casualties? Next slide, please. Then go on to ask, were you wounded or injured or hospitalized? Did you participate in any experimental projects or tests that you know of? Not so many going on nowadays, but back during World War II in Korea, there were many. Okay. Were you exposed to loud noises or explosives? Were you exposed to chemicals, gases, demolition, or other hazardous substances? Next slide, please. Also ask, have you ever used the VA for your health care? And if they say yes, Ask if they have a specific service-connected disability or condition that's being treated there, when their last visit to the VA was, if they have a VA primary care provider, and in addition to all this, please ask them if they have a place to live. Next slide, please. And we asked this question because in January 2016, we were able to identify 39,471 veterans who were experiencing homelessness. Now, this was a big decrease. It was a 56% decrease since 2010, and that was a good thing. However, 2 years later, that number started going up again, and the count was at 45,056 veterans. Most of the increase was on the West Coast in California and Washington, and we don't know why. But of the numbers that we know about, 25,000 are living in temporary facilities, and more than 15,000 have no reliable shelter. Next slide, please. In addition, 43% of all veterans are receiving food stamps, and 55% of veterans with severe housing cost burdens fall below the poverty line. Next slide, please. We have an increasing number of female veteran homeless people. This is the largest growing population of homeless vets in this country. There are approximately 3,600 female veterans that we know of experiencing homelessness. And female vets are 3 times more likely to become homeless than non-veteran females. And of the homeless females who've been identified, 1 in 4 say they've been sexually assaulted while in the military. Now, they often feel betrayed, and they often are reluctant to call themselves veterans. For those who do seek VA care, the VA has done a really impressive job of identifying and helping those who have reported delayed sexual assaults long after the incidents have occurred. And some of those people are eligible now for VA benefits because of that diagnosis. Next slide, please. So I'm going to talk about some general areas of concern for all veterans and then get into some more specifics based on where they were deployed to or assigned to. So the first one and the major thing that we hear about all the time is post-traumatic stress. And post-traumatic stress is not new. It just has a new name since Iraq and Afghanistan. Post-traumatic stress has been around for a very long time. We used to call it shell shock in World War II. But even further back than that, if you remember reading the Odyssey, Homer's Odyssey, when you were in high school, Odysseus spent 10 years trying to get home after the war, and he had nightmares and hallucinations and all kinds of symptoms that we now identify as post-traumatic stress. So it's not a new thing. My father, at age 87, was diagnosed with post-traumatic stress disorder by the VA from his World War II experiences. So it took a long time to get that identified, and it helped us figure out a lot about what was going on with him. But remember that post-traumatic stress is an exposure. It's not a disease. It's just the name. That's someone who's been exposed to traumatic, stressful kinds of events. Post-traumatic stress disorder is a medical diagnosis. So not everyone with PTS has PTSD. Okay. But things to ask people are, have you ever experienced a traumatic or stressful event when your life or the lives of other people around you were in danger? Have you experienced trauma-related thoughts or feelings lately? Do you have nightmares or vivid memories or flashbacks about the event? Do you often feel anxious or jittery? Most veterans who've been deployed will not be in a room with their back to the door. They always have to be facing the door. Are you experiencing a sense of panic that something bad's about to happen? Are you having difficulty concentrating or sleeping? These are signs of post-traumatic stress, post-traumatic stress disorder, and not just post-traumatic stress. Next slide, please. So some numbers, 4 out of 5 of Operation Iraqi Freedom and Operation Enduring Freedom warriors have a friend who was either seriously wounded or killed in action. 4 out of 5. Next slide, please. 75% of OIF and OEF warriors reported memories of an upsetting military experience that has haunted them just in the past month. This is a study done by the Wounded Warrior Project in 2013. 35% of vets returning from OIF and OEF have been diagnosed with PTSD. Next slide, please. Okay. So before I move on to sexual trauma, PTSD affects the entire family because the whole interaction becomes different. When someone's deployed and they come home, it's different. They're no longer they've lost their role for the most part as the director of family operations, basically. They don't want to talk about what happened in the war, and there's a disconnect, and it's a very sad state. And families are suffering as well. Families, when they have a loved one deployed, are watching the news, and every time something comes on about someone killed in the war, their stress levels go up as well. Family members of wounded warriors who are caregivers have tremendous amounts of stress level, and the average age for a wounded warrior caregiver is in the young 20s. So that's pretty heavy duty for a young 20-year-old to take on, who probably has little children as well. So their stress levels are pretty high as well. Okay, I'm going to move on a little bit to military sexual trauma. We always want to ask the question as well of men and women, not just women, but during military service, did you receive uninvited or unwanted sexual attention, such as touching, pressure for sexual favors, or sexual remarks? Did anyone ever use force or threat of force to have sexual contact with you against your will? Did you report the incident to your commander and or military or civilian authorities? Did you receive treatment? Were you offered medical or legal advice or both? And did you report this to the VA? The military has done a lot of work with military sexual trauma in terms of prevention and awareness. And what's happened now is it appears that the sexual trauma numbers are going up, but that's a bit of a false belief because we believe the numbers are going up because more people are reporting who didn't report before, because they're now able to make decisions about whether it would be a restricted report where it doesn't go anywhere but there's data collected, or unrestricted where there's actually investigation. So this has resulted in increased reporting without fear of retribution. And also, the VA has excellent programs for victims of military sexual trauma, and they may, as I mentioned, may be eligible for some VA benefits because of this. Next slide, please. Now, another thing we want to ask anybody who served in the military is if they've been involved in or been near a blast concussion or a blast to injury. If they've been near, experienced heavy artillery fire, vehicular or aircraft accidents, explosions, explosive devices like IEDs or RPGs, or shrapnel fragments or bullet wounds above their shoulders, because these people may have blast concussion injuries or traumatic brain injuries, even mild injuries that they may not be aware of but have caused them to alter their whole life. Okay, so ask them, did you have any of these symptoms immediately after you were around these blast areas? Like loss of consciousness, were you knocked out? Were you dazed? Were you seeing stars? Do you have trouble remembering the event? Were you diagnosed with a concussion or head injury? And do you have hearing loss? Just about anybody who's been around any of these artillery fire, aircraft accidents, explosions, etc., will have hearing loss as well. So these are important things. Mild traumatic brain injuries we're finding are very significant. They're not as mild as what we call concussions. May cause some long-lasting sequelae, including memory loss, personality change, and just loss of attention. So these are important things to ask to find out what the etiology is of what they're experiencing. Next slide, please. Suicide is a huge issue. We know that there are 20 veterans who commit suicide every day. Most of them are from our older populations, World War II and Korean War vets, but we do have one active duty suicide just about every week. Okay. Veteran suicide prevention is the VA's top priority. Now, the rate of suicide in veterans is 1.5 times higher in our veteran population than non-veteran adults. Okay. The interesting thing is that female veterans have 2 to 5 times higher suicide rates than non-veteran females. And female veterans' choice of suicide mode is gun. which is very unusual in the non-veteran female population. Okay, so they're very serious about what they do when they do it. The rate of suicide is high among 18 to 34-year-old veterans. These are our OIF and OEF veterans, and this rate is continuing to go up and is very, very concerning. Okay. The rate in 2016, the rates of suicide were highest among those veterans in the 18 to 34 age group, 34 years old. Next slide, please. So things that would heighten your awareness of a potential suicide risk are a patient or someone expressing feelings of shame or humiliation or irrational thinking or paranoia or agitation, anxiety, insomnia, irritability, despair, profound social isolation. And a lot of these come from family members not telling you, not the person themselves. The individual who presents with or communicates with you may tell you that they just look terrible. They're deteriorating physically. They feel trapped, like they have no way out. They feel like they're failures, like they don't belong. They feel like life is not worth living, feel that life has no purpose. They have decreasing performance at work, at home, at school. They have a sense of hopelessness, a sense of desperation, and they neglect their personal welfare. Next slide, please. Okay. So these were all the general things that could happen across the board with any military member. And I want to talk specifically about health risks by specific conflicts or location. Next slide, please. This slide is a little bit out of order because World War II had a lot of issues, not a lot of issues, but there were exposures to radiation, particularly in Hiroshima and Nagasaki, not only to the residents of Japan, but we had prisoners of war stationed there as well, so they were exposed as well. The Amchitka, Alaska came actually later, and I'll talk about that in a minute, but so Korea, we had submariners who were exposed to nasopharyngeal radium treatments that they were getting, not understanding that this was toxic. Okay. And then we moved to Amchitka, not we moved to, but what happened in Amchitka, Alaska was they were bomb testing there. From 1965 to 1971, the U.S. exploded 3 nuclear warheads under the island, far out in the Aleutians. There were 3,000 workers and military members who were digging underground shafts at the time. The island was remodeled by the blast, but federal officials said that no one was harmed. But what we found is that there's a huge, massive rate of cancer that occurred and is still occurring since those testings. And that was since 1965 to 71 they occurred. Okay. In Vietnam, we have exposures to, and I'll talk about Vietnam and Gulf War and Bosnia and Afghanistan specifically, but exposures to elements that put everybody in this whole list at high risk for cancers. Next slide, please. Now, Korea and Vietnam, we all heard about Agent Orange, and this is an absolutely horrendous thing that happened. We used Agent Orange, the U.S., in our planes. They were herbicides and defoliants to try to clear out the foliage in the jungle so we could see the enemy. And what happened is that Agent Orange was extremely toxic to our troops, causing cancers and birth defects to the people who were exposed to it, including people on the ground. I have a friend who was a flight nurse during that time, and the planes were sprayed as well, and she has been very ill and likely, I don't know for sure, but we think it was connected to Agent Orange. In 1991, after a lot of discovery of the cancers that were occurring, the Agent Orange Act was passed, and it made veterans who were exposed to these chemicals eligible for compensation and medical care through the VA. And this was a presumptive link between these agents. Okay. So the things that we were seeing at that time were diabetes, type 2 diabetes, Hodgkin's, sarcomas, peripheral neuropathies, and then spina bifida in the children of the veterans, and other forms of cancer like prostate cancer and respiratory cases. Then additional cancers were popping up that were prevalent in the vets who served in areas where Agent Orange was sprayed, and these were the B-cell leukemias, Parkinson's disease, and ischemic heart disease. So Agent Orange is leaving a terrible legacy, and we still see a lot of these folks in our healthcare settings. Next slide, please. something that happened for 20 years, actually 30 years, from 1957 to 1987, is there were toxic chemicals being put into the groundwater at North Carolina from industry in the area. And these were uncontrolled chemicals, and what they found was that veterans and their family members stationed at Camp Lejeune between 1957 and 1987 had a very high risk of cancers and different conditions. So the kinds of cancers that they were seeing for people who lived in this area were bladder cancer, breast cancer, esophageal cancer, lung cancer, kidney cancer, leukemias, blood dyscrasias, multiple myeloma, myelodysplastic syndromes, non-Hodgkin's, female infertility and miscarriages, hepatic stenosis, renal toxicity, and scleroderma, not just in military members, but military families, women and children as well. Next slide, please. In Vietnam, in addition to Agent Orange and all the PTSD kinds of things we saw, hepatitis C was prevalent, and this is because before 1992 we weren't screening blood donations for hepatitis C, so that could be transmitted through blood transfusions. They also had battlefield exposures to blood of someone who was a hepatitis C carrier and to human fluids. And then oftentimes they used needles, group use basically. They borrowed each other's razors or toothbrushes and other personal items from people who were hepatitis C carriers. So hepatitis C was very prevalent in Vietnam and still is found in Vietnam veterans today. Next slide, please. Okay, now open-air burn pits are a huge problem. They were a huge problem in Vietnam and also in Iraq and Afghanistan. And Tulsi Gabbard, who is an Army veteran, and she's a congresswoman from Hawaii, calls burn pits the Agent Orange of post-9/11. These were open-air burn pits that we created, the U.S. We burned everyday trash, non-serviceable uniforms, medical waste, chemicals, pesticides, or whatever else we were trying to get rid of. And what happened was these folks were, people who were around these areas were inhaling all this toxic material. And now we're finding that there's a wide variety of cancers in our Iraq and Afghanistan vets in particular, including leukemias from exposure to these burn pits. The VA does have a burn pit registry, so if you know of anyone who was serving in those areas who was aware of inhaling some toxic smokes, they should call the VA and get enrolled. Next slide, please. So Gulf War syndrome is something we're not really sure why it happened or where it happened, but people who served in the Gulf War, Desert Shield and Desert Storm have all kinds of signs and symptoms of fibromyalgia, chronic fatigue syndrome, headaches, GI problems, thinking, cognitive impairment, pain, high rates of brain and testicular cancers, and neurodegenerative diseases such as ALS and MS. And as a side note, any veteran who develops ALS, which is Lou Gehrig's disease, is considered to have a 100% veteran-related disability, no matter where they served and when they served or how long they served. So the minute they are diagnosed, they are qualified for 100% VA disability, and that means their families as well. My distant cousin was a surgeon who served in Belgium, developed ALS, and he was designated as a VA, 100% disability VA. His daughter received some subsistence through college, and in certain states, these folks, people with 100% disabilities, may be eligible for relief of their property taxes. It depends on the state, but this is something important to know too. So when he passed away, I talked to his wife, and she didn't know about the property tax issue. She went to the Maryland VA, or Maryland Veterans, and talked to them, and they said, yes, you are eligible, and she actually got 7 years of post-property taxes paid back to her as well. So these are certain important things to know, not just for the treatments of diseases, but what kinds of benefits people can have when they have these things. Okay. Next slide, please. So in Gulf Wars, Desert Shield and Desert Storm, and in Bosnia and Afghanistan, there's a whole bunch of depleted uranium around. And it's in the soil, it's around in the air, and our troops are inhaling or ingesting microparticles of, and this is heavy metal toxicity. And these folks are at high risk for respiratory and renal diseases. So again, important to know when you served and where you served. Next slide, please. In Iraq and Afghanistan, and now we have many troops in Africa, all over, particularly Eastern Africa, there are infectious diseases. Malaria is rampant unless you take your malaria tabs every single day. Typhoid is there, viral hepatitis, leishmaniasis from sandflies. Tuberculosis is heavy in the African population, and it's easily spread, and rabies from animal bites. So it's not just the wounds of war, but actually infectious diseases as well that we're seeing. Next slide, please. I just wanted to mention some really interesting current research. Chris Casper is a member of the American Academy of Nursing. She's also the new dean at the University of New Mexico, and she's been doing research for several years with toxic, especially with shrapnel wounds and the long-term effects of embedded metals in someone's body, like if they had a piece that had shrapnel and it's never been removed, is this a cancer agent? And that's her research. She also recently has been looking at lead poisoning that's occurring in Navy SEALs and tracing it back to the lead powder that their ammunitions are packed in. So some very interesting work going on with etiologies of these diseases. Next slide, please. So this sort of brings me to the end of my talk, but always ask the question of any patient you see if you're in healthcare. Have you ever served in the military, or has anyone in your family ever served? So we can better identify possible diagnosis and etiologies of diseases and provide the appropriate treatments, support, and financial assistance that our veterans and their families need and deserve. Next slide, please. So if you want more information about this, you can go to the American Academy of Nursing website. It's haveyoueverserved.com. And they have materials that you can print from the website, pocket cards, posters, and lots of information about questions to ask and why to ask. Our next mission is to get all of this information into the electronic medical record, so when the answer is yes to the question, the provider knows what the next questions are to ask and where to go with those answers. Thank you very much. I appreciate your time, and thank all of you who have served and are serving.
Thank you very much, Dr. Shi. We appreciate you taking the time to really focus on so many of the medical issues and the issues that may arise with our service members, veterans, and their families, and help those in the medical community have a better understanding of some of the things to look for and ways to screen and identify our service members, veterans, and their families. Also, I wanted to note that we will make sure in our follow-up email to you to attach a link to the Have You Ever Served website and some of the tools that Dr. Sheehy was referencing. So now what I'd like to do is I'm going to turn this over in just a moment to Joe Moncher, who is the former Bureau Chief of Community-Based Military Programs in New Hampshire at the Department of Health and Human Services. Joe has been working with SAMHSA Service Members, Veterans, and their Families Technical Assistance Center for many years. She only recently just stepped down from her role as the Bureau Chief. And there she was responsible for developing military-civilian partnerships that improved education, outreach, and services. She represented the department in working with VA medical centers, New Hampshire National Guard, vet centers, as well as other military and civilian provider agencies. She also served in the U.S. Air Force and comes from a family with a strong military background. For this work, she's been working for several years to help the New Hampshire Ask the Question campaign get up and running. So with that, Joe, I'm going to turn it over to you.
Super. Thank you so much, Michelle. Hello, everyone, and thank you for the opportunity to introduce the New Hampshire Ask the Question campaign. The Ask the Question campaign encourages civilian service providers to ask the question, have you or a family member ever served in the military? There are many similarities between Dr. Sheehy's Have You Served campaign and the Ask the Question campaign. What I'd like to do in the next 20 minutes is to share some best practices or some how-tos in the development of an Ask the Question campaign for agencies, communities, or states. Next slide, please. A few years ago, I shared this slide of our American flag with the New Hampshire Legislative Commission on PTSD and TBI, who at that time was an advisor to the Ask the Question campaign. I introduced this flag slide and said that we are all part of a safety net, and every one of our roles are critical in supporting our military, and this flag represents our safety net. Well, a post-9/11 combat veteran spoke up during that meeting in disagreement, and he said, "I'm a combat veteran, I'm a warrior, and I do not need a safety net. I don't need you state providers and you civilian providers to provide a safety net for me. I'm a warrior. What I need is a support structure." Well, I'm thinking safety net, support structure. I thought the words were the same. But for this veteran, the words were not the same, and he had a very different reaction. The words we use in communicating with veterans and military families are absolutely critical. And the words we use can either engage our military or alienate our military. And sometimes we only get one shot at it. The beauty of the Ask the Question campaign is it's a simple question that creates greater communication. And communication is absolutely at the heart of good care, and communication is also at the heart of this campaign. In developing an Ask the Question campaign, creating a strong communications or awareness campaign as part of your overall campaign is absolutely critical. Now, Dr. Shi referenced some materials that they use as part of their awareness campaign. In New Hampshire, our awareness campaign includes a website, media stories, rack cards, flyers, bracelets, resource table displays, as well as an outreach team to help share and promote the message. Now, all states, all communities, we've got various teams that we could perhaps engage to serve as an outreach team. Maybe that outreach team is veteran service organizations, or maybe it's VA homeless workers, maybe it's military care coordinators. Look at the agencies and your supporters within your state. Where do you have representation that covers a wide area? And can you engage those teams, those agencies, those volunteers? Maybe it's Blue Star Moms, to be ambassadors, to be part of your outreach team. Next slide, please. In developing an Ask the Question campaign, it's also important to personalize your story and identify military ambassadors to help share this story. This slide represents a New Hampshire story, and it introduces a member of the New Hampshire National Guard who served as a catalyst for the Ask the Question campaign. Lieutenant Colonel Stephanie Riley worked in an emergency room at a civilian New Hampshire hospital. She frequently witnessed individuals presenting with symptoms of headaches, dizziness, and hearing loss. Based on their presenting symptoms, these patients were often diagnosed with migraines, provided short-term medications, and sent on their way. Lieutenant Colonel Riley began to notice, based on her own service experience, that many of these individuals might have served in the military. So she began to ask the question. And she discovered that many of the migraine patients were actually veterans suffering from mild traumatic brain injuries. Later that same year, Lieutenant Colonel Riley encountered a veteran struggling with chronic head pain and other life difficulties. He had been to 3 different healthcare facilities in New Hampshire, and not one of them asked if he had ever served in the military. By the time this veteran reached Lieutenant Colonel Riley, it was too late, and this veteran died by suicide. As Dr. Sheehy shared, 20 veterans across our country die by suicide each day. 6 of these 20 veterans are receiving care from the VA, and 14 are not. So if you look at our national demographics, over 2/3 of our country's veterans, probably over 2/3 of each state of our veterans, receive care in the community. And if you look at our suicide data, 2/3 of our veterans who die by suicide are also receiving their care in the community. This data speaks to the importance of these type of Ask the Question campaigns that encourage civilian healthcare providers to identify military members at intake. We cannot serve our military unless we first identify them. Next slide, please. One of the most important pieces of information that I've learned over the last decade in doing this work is that it is absolutely critical to acknowledge that military service is important. You may be working with a veteran who is 70 years old and only served the military for 2 to 3 years. Yet that service defines who he or she is today and how he or she defines their life today. As you can see from this slide, the Ask the Question campaign supports many different program areas. New Hampshire 211 provides a 24/7 resource line for homeless veterans. And they are able to do that because all 211 phone operators ask the question. All 10 of our community mental health centers ask the question. All 13 of our state's ServiceLink Aging and Disability Resource Centers ask the question. This Thursday, I'm serving as the keynote at one of our leading hospitals. And they've asked that I talk about the Ask the Question campaign for 1 hour as part of their keynote on Veterans Day, because that hospital hopes to operationalize Ask the Question. So in the last 5 to 6 years of introducing the Ask the Question campaign to various different program areas, various different service delivery networks, I sure have learned that the Ask the Question campaign is a campaign that can align with most, if not all, program areas. Next slide, please. The Ask the Question website includes 12 different sectors. And you can see several sectors on this slide taken right from our website. And if you go to the front page of our website, you'll also be able to hear a 5-minute video that gives a few snapshots from different sectors, from different service delivery sectors, on the impact of Ask the Question. Each sector on this website provides stories and examples of why asking is important. Each sector also provides follow-up questions and assessment tools similar to those shared by Dr. Shi earlier. Some service providers are hesitant about asking the question because they are not completely comfortable with their process, with the process that they have in place. They want their entire process to be perfect before they start. Well, our service delivery system across our country is not perfect. Here in New Hampshire, we would advocate that you start the campaign. Start the Ask the Question campaign. Put some of your staff together, have a discussion, and see how you can move forward. And I am going to provide a few tips on how to get started in a few more slides. Next slide, please. So in developing your Ask the Question campaign and selling your campaign to possible funders, legislators, or state officials, I recommend that you use some of your data that you've already got, to sell the Ask the Question campaign. And we all have data, and we've all got different kinds of data. And I'm guessing that some of the data you have, whether you're here representing an organization, a community, a program area, or state, you've got data that would probably support an Ask the Question campaign. This slide represents New Hampshire data that proved critical in introducing the value of an Ask the Question campaign, as well as moving this campaign forward. The New Hampshire Legislative Commission on PTSD and TBI conducted a survey in 2013, and we asked New Hampshire veterans about their barriers in accessing care. 1,200 New Hampshire veterans responded in this survey. And in asking, what are your barriers in accessing care, the number one barrier that came up was stigma, embarrassment, and shame. So we know that one of the best ways to tackle stigma is through communication, through talking about these things, through conversation. And so Ask the Question absolutely addresses the number one barrier identified by our veterans and probably identified by your veterans as well. The second barrier that was identified by New Hampshire veterans was, "I do not feel understood by the providers who serve me." And so that spoke to a need for more military culture training, greater education, for us to really share military culture with as many civilian service providers as possible. I would suggest, after being involved in this campaign for 6 years, that you cannot develop an Ask the Question campaign without military culture training. The two of them go hand in hand. Some of our civilian providers are nervous about serving military, so they have to get some military culture under their belt, and you can do that in a number of ways. There's a ton of online trainings. We're a small state, so we're able to do quite a few face-to-face trainings. So anytime we do a military culture training, we sure include the Ask the Question campaign. And anytime we're talking about the Ask the Question campaign, we're also including military culture in that as well. And then the third piece, in terms of a barrier in accessing care, was, I don't know where to go, nothing's going to help me, I'm only going to speak to another veteran, and no one wants to help. So again, a value of the Ask the Question campaign is all agencies have an opportunity to implement an Ask the Question campaign. Many organizations can start identifying our military. So when our veterans tell us what's on the slide right now, no one wants to help, I don't know where to go, nothing's out there, we want all agencies to participate in military culture training and to ask the question. So we did a second survey just last year, and we're analyzing it right now. And the Commission on PTSD and TBI did the second survey, which is on your slide, and we received feedback from 950 New Hampshire veterans. And we asked them again, what are your barriers in accessing care? So stigma, embarrassment, and shame came up again as a #1 barrier, but in looking at this data, and we're still kind of in the middle of analyzing it and finalizing it, we have learned that we're making significant headway on addressing this #1 barrier, as well as addressing the #2 barrier through military culture training. So these two areas are still barriers, and they're still challenges, but in looking at our data over a 4-year period, 4 years later, we in New Hampshire, we're making significant headway, and we believe it's because of the Ask the Question campaign, as well as a lot of other things, but the Ask the Question campaign is sure a factor. Now, a couple other questions we asked, which we sure are proud of. If you look at the information in the box, 75% of the veterans, of the 950 veterans that we surveyed, said yes, they have been asked the question. We also asked them if the coordination and communication between military, VA, and civilian healthcare providers is improving, and 70% of 950 New Hampshire veterans said yes. So those are great little benchmarks for us that let us know that the Ask the Question campaign is on the right track. Next slide, please. New Hampshire has implemented or operationalized the Ask the Question campaign in several healthcare and service delivery networks. One of our most successful Ask the Question campaigns took place within our 10 community mental health centers. The Ask the Question campaign literally helped to transform our service delivery system within our mental health system for veterans and especially for their families. First off, New Hampshire identified military liaisons within each of our 10 mental health centers. So this was not a new hire. These were not new positions. These were individuals who already worked for the community mental health center. And some of them were veterans and some of them were not. Some of them were simply individuals that really felt strongly about supporting our military. So each of these military liaisons devoted 8 hours each month to military work. And we learned that 8 hours was a pretty good chunk of time, and they were able to do an awful lot, whether they helped connect to the VA, or hosting resource fairs, or working with their IT people on the Ask the Question campaign. So if you look at your slide, it'll tell you what our mission statement was for the military liaisons: to improve access to and quality of care for veteran service members and their families. And then we had 3 bullets that went under that. One was to strengthen the system by asking the question. And so in New Hampshire, we're actually up to 19.6% since this slide was shared. So in New Hampshire, our 10 mental health centers serve about 21,000 clients monthly. Of the 21,000 clients that we serve monthly, 19.6% of them are veterans, service members, or their families. Now, when we started this campaign a few years ago, only 2 of our centers were enrolled as TRICARE providers. Today, we're up to 9. And it's because of our military liaisons. They have become strong advocates and ambassadors for this work, and we went from about 50 credentialed clinicians to 250. And so the military liaisons, we get a pretty good bang for our buck on that. Next slide, please. So 2 other of our goals attached to our mission statement. One was to enhance military cultural competence. And again, that was making sure that we spent an awful lot of time on military culture training. And sometimes we run into agencies that'll say, oh, we participated in a military culture training 2 years ago, so we're all set. Well, if we look at our workforce across the country and we look at the turnover, it's pretty significant. So we need to continue to do military culture training. It needs to be a goal for us every single year. And if we look at our mental health centers, 50% of mental health center staff turn over every 3 years. So again, the constant putting military culture training in front of folks constantly is very important. And then the third piece is partnering with our military civilian partners. And so one of the things we did is we brought our mental health folks from our VA medical centers, and we got everybody together right away. So we could have our civilian mental health folks talk to our VA mental health folks. And also we partnered heavily with our VA on bringing the suicide prevention Press 1 film to our mental health centers across the country. And they really, that suicide prevention Press 1 film got an awful lot of attention across our state. Next slide, please. So the Ask the Question campaign over the last several years has really supporting a lot of different military communities across the country. And there's been numerous states that New Hampshire has had conversations with about this. I want to point out a couple things on this slide. One is I want to point out the VA that's on the second item. And the VA has been instrumental in supporting this campaign from day one. One of the mental health directors from our VA served on the DHHS review team when we were first introducing the Ask the Question campaign. When we first released the Ask the Question website, we got an awful lot of questions from older veterans who just assumed that we were connected to the VA or that we were the VA. Because a lot of our older veterans, they look to the VA for a lot of this work. So we put VA frequently asked questions on our website. We put VA resources on our website. The Commission on PTSD and TBI served as an advisor to the Ask the Question campaign for a number of years. And that commission also includes representation from our VA. So it's real important to include the VA in this work. It's important to include the VA in all of our work. I would also point out to the George W. Bush Institute conference call. What struck me from that conference call is a discussion around veterans being hesitant to ask for help. And we hear that quite a bit. Our veterans are hesitant in asking for help. So the value of an Ask the Question campaign, it puts some of the responsibility, some of the ownership on the civilian provider sector. We recently, one of our adjutant generals of the New Hampshire National Guard would often share a message that, as the National Guard, they see their men and women some of the time. Out in the community, we see those men and women all of the time. So again, it puts the opportunity and the responsibility on the civilian sector. Now, on this slide, you'll also see that we've presented a few times in front of legislative summits. and there's always states that are interested in legislating the Ask the Question campaign. We have chosen not to do that in New Hampshire. One of our challenges is, what part do you legislate? Do you legislate hospitals? Do you legislate state entities? Do you legislate university or colleges? So it's definitely, I'm not saying it's a bad idea, but it's definitely worth consideration. When you look at Ask the Question, what's your target group? What program area do you hope to impact? Next slide, please. In developing your Ask the Question campaign, this slide provides a quick snapshot of some of the key components. And like a lot of different campaigns, securing top leadership is the most important part of initiating an Ask the Question campaign. But yet, if I look at what we've done in New Hampshire, oftentimes securing top leadership doesn't happen until you first get top leadership at a military culture training. So again, I have to go back to the importance of military culture training. Organize a military culture training and make it the best training it can be. And then get the right people at that room. Because people always need to know, why should I do this campaign? Why is this important? You have to sell that to top leadership. Then you're going to get a lot of people in that military culture training who want to support this effort. So then you want to put together an internal military team. So you can listen to folks like Dr. Shi and myself in SAMHSA and a lot of other states. But at the end of the day, the people in your organization, the people in your community are going to be the ones that are going to transform your healthcare system. So pull those people together, whether they're veterans, family members, or civilians. Pull them together to create an internal military team. Then you want to identify a military liaison. Is there somebody from your agency that could serve as the point person? Maybe that person coordinates a tour with the VA. That person coordinates the military culture training. That person works with your IT on setting up an Ask the Question campaign. That person works with your HR and identifying others within your staff who are military. So when we suggest you ask the question, you want to ask the question of your patients, of your board of directors, of your volunteers, of your staff. This campaign is all hands on deck. So you also want to share resources, and military resources are critical. You can do that by adding that information to your website. You can do that by putting information in your lobby, by putting some quick handouts and giving them to your receptionist, by having a military resource guide or a military library, if you will, in your agency. You also have to train intake staff. And this part surprised me a little bit. So we had agencies call us and say, geez, I just had this angry veteran, and I asked the veteran on the phone, I asked the individual on the phone if he had ever served in the military, and he got angry with me. And he said, hey, I've been coming to your agency for a while now, and you've never asked me this before. Why are you asking me this? Well, the answer is simple. It just needs some discussion. Your answer could be, we at Agency ABC have always served and supported and honored our veterans and their family members. What we're doing is we're putting some new decisions in place. We're putting some resources together. We're putting a team together to make sure we're doing it in the best way possible. And we've learned that the best way we can serve you is to first find out how many veterans are receiving care at our agency. The next piece is you have to engage your IT staff. And in New Hampshire, we've got 10 mental health centers, and of course, they're on 10 different IT systems. So adding the question is sometimes not as easy as we would hope. And then the final piece is partnering with the VA. We got to partner with the VA in all areas, Creating a strong VA military and civilian partnership is critical. So I would suggest if an agency wants to transform their healthcare system, you're not just working with your clinical staff. You're not just working with your IT staff. You're working with your HR staff, your marketing staff, your sponsorship staff, your communication staff, your leadership team. All hands on deck. Next slide, please. The beauty of the Ask the Question campaign is is it supports a very broad definition of a veteran. For the last 10 years that I've been in this job, this is my favorite definition of a veteran because it's a very broad definition and it captures many more people than some of the eligibility criteria that you might find at the VA or at the Department of Health and Human Services. And by providing a broad definition of a veteran, it also supports a broad approach on how we serve and support that veteran, that service member, or their family. Next slide, please. I invite everybody to check out the Ask the Question website, and best of luck to all of you as you serve and support veteran service members and their families across our country. Thank you.
Joe, thank you so much for that great presentation, and hopefully all of you who've listened today really have come away from both presentations having a better understanding of how to implement this initiative and these initiatives, and also why it is so critically important. We're going to get into questions and answers in just a second, but what I wanted to do is just quickly, if you could go to the next slide. We've included 2 slides. You will get this slide deck in a follow-up email, and there are military culture resources. You heard Ms. Muncher talk about the importance of military culture training when you ask the question, making sure that people who are asking the question also have the information they need to be able to support our service members, veterans, and their families. And there are some really wonderful military culture resources. Here's just a few. You can go to the next slide. And there are some additional resources there as well. This is by no means a comprehensive list, but they are just some great resources for you. Next slide, please. The other thing that I wanted to do before we jump into questions and answers is just note that this is a very special event. We wanted to feature this topic so that we could advance this message, so that we are better recognizing our service members, veterans, and their families in our service systems and in our communities. So we, throughout this month of November, throughout the month of the Military Family and Veterans Day, will be rebroadcasting this webinar. Over the next several weeks, you're going to receive some resources from us. You'll also receive a link to our webinar that's going to be broadcast on our YouTube channel. So that will be coming in a subsequent email. We would ask, if you felt that this webinar was helpful and valuable, that you pass it along and share it to people who you think may benefit from this information. You will receive the direct link to the webinar archive by the end of this week. So with that, I'm going to turn it back over to the National Council for some questions and answers.
Thank you, Michelle. And I'm just going to keep this slide up while we're going over the questions, just so you guys know how important this is to us. So I'm going to start going through some questions. I know we have some limited time, so I appreciate our speakers being able to answer as many as we can within the time constraints. And the first one that I'm going to start with is for Dr. Shi. During your presentation, you talked about PTS and PTSD, and one of the questions that was put out there is, can you talk more about what the difference between PTS and PTSD are?
Sure. Post-traumatic stress is experienced by just about anyone who sees a horrific event happen. So it's just happening, it's in your life, your adrenaline rushes, it's scary, it's frightening, you think about it a lot, and it's not anything you'll forget. But post-traumatic stress disorder is when the symptoms get so bad that you can't sleep, you can't function as you used to do, your whole personality is changing, and you need help. Post-traumatic stress is normal. I think anybody who serves in a combat area has some post-traumatic stress. That's a normal thing. But it's the distress post-traumatic stress disorder that needs to be treated. So the military is doing a lot of work now. They have embedded psych mental health workers at the front lines in Afghanistan and Iraq, mainly Afghanistan right now. They do a lot of on-the-job, on-the-spot interventions when a horrific event occurs to try to prevent that from becoming a post-traumatic stress disorder. So the disorder is actually a diagnosis. The stress is an event that happens itself, but it's not. PTS is not the disorder, but it's the event that happens that you witness. So I hope that's clear.
That was really helpful. Thank you so much. So this question is for both of you based on your thoughts and perceptions. So we talked a lot about the types of questions that you can ask. And one of the questions that we received is, at what point in the treatment process do you ask these questions? You know, for some of these, it seems like you really need to have an established trusting relationship in order to be able to have the patient feel comfortable answering them.
Joe, do you want me to go first, or do you want to go?
Sure. Go ahead, doctor. Thank you.
I think for me, my role in life has been as an emergency trauma nurse, and I think we have very limited time in the emergency room to make a good connection, so we try to get as much information as we can. Sometimes these questions can be asked over time, but sometimes they're critical to trying to figure out what this disease is and what's causing it. Like Joe mentioned, the person with headaches who for years was being treated for migraine headaches, and then someone asked the question and found out that this person actually had a mild traumatic brain injury. So it just depends on how quickly we need to move on what the diagnosis is and where it comes from. So I can't answer that question really clearly. Do you do it all in one sitting? Is it over time? Yes and yes.
Sue, and I would add, first of all, I agree with everything Dr. Shi says at any time during any conference. So I think we need to ask this question as early as possible. And you never know where the help might come from. For example, we have one of our hospitals that they ask the question early on, right at the very get-go at the hospital. And if somebody says yes, they give a business card to that person that has a military liaison's name on it. So they have somebody at the hospital who is not a veteran who actually works in the accounting program. But that person has identified, wants to serve as a military liaison and does an amazing job. So this person might be identified, and maybe they need housing supports, or maybe they want to go to a resource fair, or maybe their children are having trouble in school because of their dad's deployment. So I think we need to really look broad at the Ask the Question campaign, knowing that help could come from a lot of different places.
If I can just add to that, this is Sue Shi again. The American Academy of Nurse Practitioners has a campaign called We Serve Too, and it has to it specifically addresses children of military members, and it's a really lovely program.
Great. Thank you both so much. So this question, I think, ties a lot to, Joe, what you were talking about in terms of the definition of a veteran. Can you talk about how you talk to those who may have served in the National Guard or Reserves but have never been deployed, and are they considered veterans in this broad definition?
Sure. Well, they sure are all considered military, and they all have served our country. I'll give you an example. So I got in front of a group once, and I introduced a combat veteran, and he came to speak. And after he finished speaking, he came up to me, and he was very, very upset with me because I introduced him as a combat vet. And he said, when you introduce me as a combat vet, you are dissing all of my brothers and sisters who served this country but did not go to war, and they didn't serve in combat. And so I talked to one of our generals after that and said, geez, did I screw up on this? And she said, absolutely not. Every veteran, every military person looks at their military experience very differently. So I think it's important to share, that we all define that differently, and that's okay. And I had a county attorney once ask me, geez, we've got a veteran who came our way, and that veteran has a dishonorable discharge. So are they really a veteran? And our answer is, we have to start with this very broad definition. And our job is to serve people, not judge people. So everyone defines it differently, and we want to be very broad in our definition of military as well as our definition of a military family member.
This is Sue Shi again. It's interesting that our National Guard and reservists have done more deployments than many active duty people because they get deployed over and over and over again, where a lot of our military get deployed and then they come back to a PCS assignment for a year or 2 or 3. So they've really bore a huge burden in these last 2 wars.
Thank you both so much. And I like, Joe, that you also moved into talking about the broad definition of family members as well, because that was a question that came up quite a few times also. So I think that you both did a really great job of talking about the resources that we have available that tie to everything that you were talking about. And I want to reiterate to everyone on the line, because there are a lot of questions around resources, that these slides will be sent out with access to the hyperlinks and additional resources. But a few things that stuck out to me were really questions about, is there any particular tool that align with the key questions that Dr. Shi outlined that people can access, or that you want to, make sure that people know is out there? In addition, there's been quite a few questions about, is there a list of states or other groups who are doing Ask the Question or similar campaigns that somebody could access to understand what's going on in their region?
So I'll leave the question regarding tools to Dr. Sheehy, because she is sure the expert in that field. Regarding other states that are doing it, I know this question was posed to us a few months ago, and there's a handful of states. All of them are very, very in the very early stages. I know we also have a handful of states that have gone through the legislative route, whether they might have worked to legislate a piece of the Ask the Question campaign within their hospitals or within their state health care, or I believe there's another one that did it within their schools. So this is very much a pioneer effort, and a lot of us are at the very, very beginning stages.
Correct. And this is Sue Sheehy. In terms of tools, with the American Academy of Nursing, we just relatively recently, in the late spring, held a conference on Capitol Hill called The Critical Conversation, Have You Ever Served? And out of that conference came the clear message that we need to develop some algorithms and have them put into electronic medical records everywhere. It's not done yet. We're just getting started on that. And if anybody has some good contacts, let us know. It's a very, very difficult question to have answered. We've been working on that for a couple of years now, but we're bound and determined that we are going to do that. Because when you ask the question and the answer is yes, what do you do after that? So I think people would need help and a little bit of guidance about what to do and where the resources are. So I think that's important. We have a lot of people doing a lot of good work, but we're not all communicating with each other yet. But we're getting there.
Now that is really exciting. So it would be sort of a clinical decision support tool that would not only prompt providers to ask the question, but also help them work through what the next steps are and how they can link people to the appropriate care.
Yes. And I'm in total agreement with Joe about hospitals needing military cultural awareness because so many vets and military members and active duty military members are now coming to civilian facilities for care. A very interesting pilot project that's going on is with Holy Cross Hospital in Silver Spring, Maryland, and they're a part of the Trinity Healthcare System. I think they have 96 hospitals around the country, but the CEO there is a fellow named Van Coots, retired Brigadier General, who was the commanding officer at Walter Reed and also in Landstuhl, Germany. And now he's retired, and he has a whole program that he's put together. It's a pilot for the moment. They have a military clinic that they set up, Veterans Clinic. They brought in people to teach the entire hospital staff about military cultural awareness. They identify veterans immediately if the veteran wants to be identified. Then they have special programs for military spouses and children as well. And I think this is the way to go in our civilian facilities because because we're going to be seeing lots and lots more vets and military members and their families. So, and I'm sure he'd be very open if you just dropped him an email or went, he's the CEO of Holy Cross Hospital in Silver Spring, Maryland. And his name is Van Coots, C-O-O-T-S. He's going to kill me for telling everybody to email him, but he's a very open person.
I really appreciate you sharing that. I think, for me, it's always helpful to hear about specific examples of how providers have been able to really take this information and make it their own and work for their organization. Specifically, Joe, I think, the slide that I really liked that you had was the transforming a healthcare system and talking about the stepwise approach that you can take and the key considerations you need to make, right? And I'm wondering if you or Dr. Shi, if you have any other, specific examples of organizations that you've seen be able to really embody this, and what have been the key factors for them?
Sure. Well, I would share, I'd like to recognize Lehigh Valley in Pennsylvania. So I've never met anybody from Lehigh Valley, Pennsylvania. I've never had a conversation with them. But SAMHSA did some research for me maybe a year ago to provide some toolkits, if you will. And we were looking, New Hampshire right now is in the process of creating an Ask the Question toolkit, transforming healthcare toolkit. And in researching other states, Lehigh Valley, Pennsylvania has put together a healthcare community toolkit that is just, I think, beautiful. It's got all kinds of very wonderful tips that you can implement. So I would suggest that. I would also throw out, hospice care. I know in New Hampshire, 50% of our veterans are over 65 years of age, and I know Dr. Shi also talked about suicide within our military community, especially some of our older veterans being at risk. And I know we engaged our hospice community regarding some of our efforts. And I heard from one of our hospice workers who said that during the hospice time within a veteran's life, two things usually come forward: what's most important to them and what's been most traumatic for them. And so it was pointed out to me that we really need to ask the question within those individuals we serve under hospice care as well, because oftentimes their military service is something that surfaces, and sometimes it's a surprise to the families.
This is Susan Shi again. I just came from a meeting at the American Academy of Nursing, and I learned about a program. The University of Colorado has 2 online programs that they're offering to providers. One is a master's degree in military and veterans healthcare, and it's an online master's, and the other one is a certificate program of military and veterans healthcare, all online, and they both sound fabulous. From the University of Colorado in Denver. No, I don't know if it's in Denver or Aurora, Colorado.
I would also share that there's a lot of groups that provide military culture trainings out there. I would like to suggest Psych Armor out of San Diego, California. So they do a ton of trainings, and you can get educational credits for participating in those trainings. One of their trainings includes the top 15 things a veteran would like a civilian service provider to know. And it's a quick little workshop, and there's 15 things that our veterans surveyed across the country would like our civilian healthcare providers to know. For example, one of them is, we're not all soldiers. We're Marines, we're sailors, we're from the Coast Guard, we're from the Air Force, but we're not all soldiers. Another piece that they share is, we didn't all serve in infantry. So there's some really basic things that are important that our veterans believe civilian providers should know. So I would invite people to look on the Psych Armor website and to check out some of their trainings.
Thank you, Joe. And this is Michelle again, and I just wanted to jump in quickly. In the slides that you will be receiving in the Military Culture Resources, we have included a link to the Department of Veterans Affairs Community Provider Toolkit, and that's also a really great resource that all of you can use and find helpful.
Thank you, Michelle. So I think we're going to take this time to wrap up. I really want to extend a large thank you to our presenters again, the audience for being so engaged. This is an important topic, especially this time of year when we have Veterans Day coming up. So really thank you everyone for attending today's webinar. The SAMHSA Service Member Veterans and Their Families Technical Assistance presents Asking This Critical Question Can Make a Difference. Have you or a loved one ever served in the military? Just want to remind you that once you leave today's webinar, you will receive a survey on the presentation, and we would appreciate if you could complete that and provide your feedback. You will also receive a follow-up email by the end of the week that includes both a link to view a recording of today's webinar and the PDF of the slides, which a lot of people have asked about. So on behalf of the National Council, Policy Research Associates, and SAMHSA's SMVF TA Center, I'd like to thank you for joining us today, and please enjoy the rest of your day.
Thank you, everyone.
Thank you.